Oh, and welcome to another episode of the Herbal Mana Podcast, where we look at all things natural to help you hurt less and live more. I'm Todd Bailey, the CEO of Herbal Mana, and today I've got a special guest. We have Alka Badshah, and she has an interesting background that led her to create Anarti Therapeutics. Now, initially, you weren't a chemist, a botanist. So how did this come about? How did you get on this path? Because actually, before that, what's your professional background? Because this is really interesting. We
So,
all have different backgrounds. Yours is
yeah,
that.
and I believe in organic career. You don't chart it, you do what comes your way, what makes sense. So, starting with that, I actually did my undergraduate in architecture, which is building architecture, and then came to this country, and this was in early 80s, and the computers were just catching on. And I do have a technical bend in terms of math and science. So I said, you know what? I was an F2 visa. So I said, I'll try it out and see what this is all about. And I took some special classes, got a full ride at MIT to do my graduate degree at Media Lab. And then the rest is history. Then I worked for many technical companies like Digital, Hello, Microsoft. I was finally at Microsoft. I was a group manager there. I was managing a group, UIX group. And then this was up until 2004. In 2001, I was diagnosed with fibromyalgia. I tried to get all the medications I could. I finally went for Ayurvedic treatments. That helped me actually go back to work. And I got another 3 years out of it. But ultimately, it came down to I didn't have enough hours in the day in terms of my energy and my focus. So I had to make a decision. I have 3 kids, young at that time. And so it was family or work. And so I had to basically make a choice and left Microsoft. Focused on my own well being. It was kind of I went from prescription to prescription because everything, if it had a side effect, I would get it. And so I was living in a daze. I could barely walk a block, didn't have much energy. I used to joke that if I can accomplish taking a shower in a day, that was a big accomplishment. So it was pretty bad. And then I went through all the prescriptions, and about 7 years back, I was on a prescription that I started gaining a pound a week. So it was kind of working for my pains, but pound a week is not sustainable. That's when I went to my doctor and said, look, even though this kind of works, it's not sustainable. I can't gain a pound a week. So I decided to go on ibuprofen. I was taking a heavy dose of ibuprofen morning and night. And my doctor said, fine, you can go on ibuprofen, but I have to monitor your kidneys because ibuprofen is not good for your kidneys. So I did that for a year and then switched to Tylenol. Again, that's not good for your liver. So I was aware of that I'm in effect taking something that's not good for my body. So I was experimenting with CBD on the side to see if that works. And it seemed to be working. So I told my doctor I'm now discontinuing any medications, including Tylenol and ibuprofen, and going on the, CBD. And it's been 5 years now. And I have not taken any medication. I mean, I might take, if I walk 20,000 steps, if we are traveling, obviously, we can get some aches and pains. So that's when I will take a Tylenol. But otherwise, on a daily basis, I do not take any of those things. So I'm just taking my formulations, which is this one. And I take this every day, once a day. So after that, after started taking this, not only did my pains decrease, I'm actually productive the whole day. I can focus on a task. I don't have a mental fog, and I don't have, fibromyalgia comes with depression and all kind of mental issues. So all that went away. And that's how I'm managing my pain. I have the CBD balm, and that's the one that I take for my massage, and she massages me with it. And if I have a point pain, like if I have my hand sometimes pain here, I would put that balm and wrap it in a crepe bandage at night. by morning, the pain is gone. And what's amazing is it doesn't come back. So it's
Oh,
actually gone. Same thing with my knees or any point pain. It actually temporarily, I won't say it cures it permanently, but it cures it enough that I don't have to worry about it for a few weeks or a month. So that's been really, this combination has been my lifesaver.
sure. I got off trying to use ibuprofen, Tylenol because those
Yeah.
just lead to organ damage, all kinds of problems. I've been on that path. I was an over-the-counter drug abuser. I would do, like you've done, ibuprofen,
Mm-hmm.
prescription dose 3 times a day just to cope until I would start to pass blood or have other side effects. Then I would switch to Tylenol or Aleve or whatever I could get my hands on.
Right. Right.
Whatever the doctors could provide or prescribe, it always worked briefly. And it always came with baggage, tremendous baggage. We hear that
Yeah.
especially with fibromyalgia. In fact, the bigger problem for a lot of our customers with fibromyalgia is just getting acknowledged that they actually have a problem. That is a true frustration.
And that's what I went through when I was diagnosed in early 2000, actually 2001. Most doctors did not acknowledge fibromyalgia. And luckily I was seeing a rheumatologist who did know about the condition, so she did diagnose me. But there were no medications at that time for fibromyalgia. So what they were doing was repurposing the depression medications, and that had its own issues. I was not depressed at that time, and they were giving me depression medications because that's what doctors were doing at that time. Now there are some more, like you showed me, there are some solutions for fibromyalgia. But again, one of them I took, Lyrica, I'll name that. I started gaining a pound a week. So that's the one.
Can't do that. That just leads to other problems.
Right, right.
Okay, the first product you held up. Can you hold that up again? That one. What do you do with that?
What is in here? It actually has my story a little bit. It has hemp derived CBD. It has ginger and tulsi, which is the holy basil, which is actually an adaptogen. And then it has, let's see.
By the way, I love your website. Really clean, makes good sense, good storytelling as well. It's a great website.
Yeah. So it has holy basil, turmeric, and ginger. And these are all there to provide their own benefits. Like holy basil, I said, is adaptogen. Turmeric is an anti-inflammation, and ginger helps with the digestion and is an anti-inflammation. So all these add to the effect of hemp. In fact, and the other thing I want to talk about is what you see here is these three kinds of CBD: the CBD, CBG, and CBC. And let me talk a little bit about that. CBD, I think everybody knows about CBD. CBG is for cognitive. So that's the one that gives you mental clarity, anti fog, and feeling just better. And CBC is for pain. Now, just to give you a sense, CBC in its wholesale price is 10 times as much as CBD, which is why it is not used a lot. Because yes, there's a lot of CBD gummies in the market, but they use the cheapest ingredients. But CBC is the one with my experimentation that I found was the most effective for me, which is why this formulation contains that. And this formulation is, I use a manufacturer in Colorado, and they have their own products. In fact, I was buying their products before. And I told them, my product seems to be much more effective than what I've been using from you. And they said, yes, I think the addition of Ayurvedic ingredients just complements the CBD and helps you more.
Yeah, the CBD entourage effect. Yeah, the
The
CBD.
entourage effect. Yeah.
Having the blend is potent. And I've done a lot of experimentation as well, topically and internally. And the combination that you're using internally, I have found really does move the needle. It helps. Topically, I found that it's okay. Internally, and especially since you've got ginger and turmeric, that's a great combination.
Right, right. And let me talk a little bit about this one. This one has 800 milligram CBD per ounce, which is probably the most potent I've found in the market. And then, of course, it has arnica, calendula, boswellia, which is also frankincense, cayenne, and all these again help with the pain. The calendula is an anti-inflammation. Cayenne actually works with your nerves. It calms down your nerves, which is anti-intuitive. Boswellia, frankincense is also anti-inflammation. So all this combination of these plant-based or Ayurvedic extracts help with the CBD. And it smells great. It doesn't smell like hemp.
By itself is not a great smell.
No, I don't like that smell.
It smells like part of the haystack when you get down towards the bottom of the stack. I grew up on a ranch.
Yeah, no, this smells really good. In fact, when people open the balm, first thing they say is, wow, this smells really good.
Okay. So, what are the challenges that you have in manufacturing and making sure that you've got the ingredients you really want to put into the product? What's the process and how do you prove that you're getting what you're getting?
Okay, that's a great question. So I'll answer it in two parts. I use the manufacturer in Colorado. It's a CGMP facility. They have their own standards in terms of making sure each ingredient that comes to the lab is tested for toxicity, metals, and everything. And they're all organic. So that's why I have the organic seal, USDA organic seal. They're the ones who I was using the products from. And then I decided to formulate my product with them. They ordered all the oils that I wanted to add to the formula, so they don't use it in their products. They used it just in my products. And then of course we tested, sent me some samples, and we went through a few iterations. I wanted the smell to be just right. I wanted the effectiveness. I went through the quantities of how much CBD I wanted and all that. They have a balm which is much less CBD than this one. So we went through some trial and tribulations through that to get the product right. They are the ones who are manufacturing it and storing it there and then shipping it as the orders come in. And then being told by them that they actually ordered a little bit more of the product of the oils. So if I have to do a next batch, it won't be a problem. So there won't be a supply chain problem. So that's the manufacturing side of it. I did get some in vitro testing done for the oil to see the effect on inflammation. And the study we did was on cytokines, which are the proteins that actually creates pain signals, and they are meant to inform the brain when you have an injury. But what happens is they get out of whack. So they start producing more than they are needed. And that is the reason you get inflammation. So we tested that, and in vitro testing showed 50 to 75% decrease. And that's the study that's on my website, decrease in the inflammation cytokines.
That was you commissioned that study?
Yeah.
Interesting. I did not pick that up when I read it on the website. Very
Yeah, it's
okay. I love that. Well, you have to be a little wacky about the details and the quality. And I can see you're kind of on the wacky side as far as making sure you're getting the right ingredients, the testing. I love that you did that follow-up in vitro testing. And it's important because we see a lot of substandard CBD products. There's some outstanding products, and then there's some that are a little sketchy. I remember not long ago, I'd go to Amazon, for instance, and I would see a hemp cream with 5 million somethings. And it wouldn't really say what it was. And it gives the impression million milligrams. Of course, you can't fit that in a 5-gallon bucket, let alone a little jar they're selling. And there's no regulation. So at times there's no particular push for some companies to get it right.
Mm-hmm.
I always love it when I see somebody who's really spending the effort, taking the time, doing the lab studies, doing the follow-ups, because that's what we need, especially with the product.
Right. And like you've seen with my story, I know this thing works. I also know that the marketplace is flooded with all kinds of things. You have CBD gummies that sell for $20, $30, but it doesn't have what it needs to be effective. Yeah, that might make you feel good, maybe for an hour or two, and it's more for recreation, not for pains and for any medical effectiveness. So I knew the field was really flooded. I knew that I have a good quality product and I wanted to differentiate that. And that's what I say that my differentiators, and of course, my ingredients are all organic tested, and the test results on the site, they're tested for microbials, metal, everything that bad that you can think of. And they are manufactured in a place. It's not done in my garage. It is manufactured in a proper facility, and I know it's effective. So that's one differentiator, that I know it's effective. The second is the combination of Ayurvedic ingredients that create the entourage effect and make it more effective. So for this, for example, my husband uses it because he has anxiety attacks. And since started taking this, he has not had to take his prescription. He sleeps through the night. He wakes up. When he wakes up, he's not groggy. And he was having a lot of trouble sleeping. Now he sleeps. He has to wake up to go to the bathroom. He does that and goes back to sleep. So it's been very effective. My kids use it. They don't have pains, but they use it because it calms them down. It helps them with the sleep. So there are benefits that are other than pain, which is why
Sleep part. That's often missed when we're addressing fibromyalgia and other pain.
Mhm.
See, study after study, if you don't get adequate sleep, your pain seems more acute. Your body
Yes,
registers a higher level of pain and it becomes a higher persistence recognition of pain. Higher
exactly.
persistent, it just wears on the body. It's part of the problem with fibromyalgia. It just wears you down.
I would say that if I missed one day of sleep, it was a spiral down because it would complicate the next day. And the next day, if I slept during the day, then I couldn't sleep during the night, which meant that next day I would feel crappy again. And sleep, I think, is a gateway to well being.
It is. And it's not well addressed from the pharmaceutical side.
No.
If your husband's having anxiety and it's causing sleep issues, he can have a prescription which might lead to more depression, more anxiety, suicidal thoughts,
Exactly.
all that other stuff. Or he can be prescribed a sleep medication which gives him terrible dreams and night terrors and
Right.
other problems.
And that's the beauty of this, that he has it after dinner. He's still awake for 2, 3 hours after that. He sleeps when he needs to sleep. He wakes up when he wants to wake up, and he doesn't feel groggy. I mean, if you have some of these prescription medicine, I used to take Tylenol PM once in a while and then I woke up really feeling groggy in the morning.
It's not good.
Yeah.
Even if I just take a couple, and I'm a big guy, and I can even take a couple, but I'll wake up the next morning, I'll get my 6, 7 hours of sleep with it, and I'll be dragging for several.
Exactly, exactly. So I was careful. I didn't take it the day I had some meetings and stuff like that because I knew that I might be able to sleep, but I'm not going to feel good tomorrow.
Yeah, that doesn't work. It doesn't work when you're running a business or a household. It just does not work.
Yeah, yeah. So ever since I've started, I track my sleep on my watch, and every once in a while it tells me you've achieved your sleep goal for so many months now, for so many years. So I know that I'm getting the sleep I need.
Wonderful. When you started out with fibromyalgia, how long did it take to get a diagnosis? Because I know at times this can be a challenge.
Yes. So lucky for me, I was seeing a rheumatologist as my PCP anyway. It did take about 3 months to diagnose it because they want to rule out everything else. They check my thyroid, they check to make sure I didn't have osteoporosis, they wanted to rule out everything else that could be causing diabetes and everything else to make sure that there was no other reason for me to feel the way I was feeling. And once all the tests were in, which took, I'd say, about 3 months, she did my tender points, she checked my tender points, and that's when she diagnosed me with fibromyalgia.
It's faster than a lot of people experience. Often it drags on months or years before they come up with a diagnosis and a game.
Yeah, I think my luck was that I was seeing a rheumatologist and she knew about it. If I was seeing any other doctor, I would have had the same experience like you're talking about.
Fortunately, you were seeing a rheumatologist. Unfortunately, you needed to see a rheumatologist.
Exactly. Exactly.
Interesting. Well, it sounds like you're in good hands. I know a lot of folks struggle to get that, just the acknowledgement they have an issue, that they're not somehow faking symptoms or looking for attention. And it's a pretty frustrating process.
Right, right, right. And the good thing about this, like I said, my sons take it, my daughter-in-law takes it just for sleep or just to calm down. Some take it every day, some just take it in a tea in the evening as a bedtime tea. So the prescriptions you take when you have a condition. I think this is something I'm taking for my condition, but people can even take it for other things like sleep and just to calm down. I think people are looking for an edge, whatever edge they can get. And I think if they can sleep better, if they can get some mental clarity, even 1% edge goes a long way.
A study recently comparing sleep deprivation to being drunk at work.
Yeah. I want to, I want to tell a story about a friend of ours who lost a son, unfortunately, a very young son. And after that, she couldn't sleep at all. She felt really bad. She said, I don't sleep. I feel, I have bad thoughts all day. And I gave one of these to her, the oil, and she started taking it. And a week later, she said, "You know what? I'm not only sleeping, I have positive thoughts, and I never thought I could feel that way." She doesn't have fibromyalgia, but she was just going through a bad patch.
Well, then let's dig in just a little deeper on that one. One of the things that's wonderful with CBD, for those of you listening that don't know much about CBD, CBD will interact with little receptor points all over your body in a system that looks a lot like your nervous system. If you map this other system and you put a picture next to it of your nervous system, they're going to look very similar. One is the nervous system running your muscle functions and organs. The other is your endocannabinoid system. Not talked about much in med school. It was up until about 90 years ago. Now it's kind of coming back. It was suppressed for quite a long time. One of the problems with the endocannabinoid system is that it deals with naturally occurring substances like the cannabinoids that you get from CBD, which cannot be owned by a pharmaceutical company. Therefore, it's not interesting to them. And they work pretty hard to suppress the use and even the knowledge of the endocannabinoid system. Now, this is where it gets kind of fun with CBD. You take the CBD, like the Anarti oil, and the CBD will interact with those little receptors, CB1 and CB2 receptors all over your body, and it gives your body a sense of homeostasis. You might call it a chill, a grounding, and that's why we can sleep better. It's also why we hurt less. When you can calm your system, your body doesn't register the pain as acutely, and it doesn't create a circular problem that pain often does, where you have pain that amps up your anxiety, which causes more pain and more anxiety. And the CBD helps tamp all of that down. So I think it's brilliant. And then having the other anti-inflammatories, the turmeric and ginger, which besides helping with digestion is great for pain. Great for pain. That's a wonderful combination. It's a heck of a substance. And it's interesting that it's still a little bit misunderstood and a little mistreated. Hemp-derived CBD has been legal since December of 2018. It's still a bit of a battle in the marketplace.
Yeah.
I know that when you're using a payment processor, for instance, you have to pay a surcharge because you're in a high risk category, even though what you're doing is completely above board, completely legal, completely authorized by federal law. And yet the credit card companies still want to take advantage.
Mhm.
If you want to advertise your product on Facebook, don't bother. Google, don't bother there either. Even though it's completely legal, it's still somewhat blacklisted. And it's interesting because it's a wonderful, naturally occurring substance that you're using.
Right, right, right. And this oil has zero THC. There is absolutely no THC. So even though there is a legal THC level, but this one, what I wanted to make sure that there is no THC, because I know people who need to be drug tested or anything like that, they have inhibitions. So because of the entourage effect and because I have CBG and CBD anyways, CBC, they want to add THC to have that entourage effect. But I didn't need that in this because of all the other ingredients.
Yeah, the THC is just too problematic. That is one to stay away from.
Yeah,
You might
exactly.
have regulatory problems and just
Even though 0.3% is still legal, but I have a credit card processing company. Of course, they checked out my site and make sure that they checked out my COAs to make sure everything was legal, and I can now ship it to any state in the US using USPS or any regular shipping company. So it's all legal.
Now it's legal.
Yeah,
Just mistreated.
it's mistreated.
It is. Now, you mentioned COA. Let's dig into that a little because not everybody will know what a COA is.
COA is the certificate of authenticity. And if you are selling CBD products, you have to have it on the website. And actually, if you go look at it, it's on my website.
Yesterday,
Yeah. COA batch database has.
I can tell you, I'm really skeptical when I see CBD and I can't find the lab work. And
Yeah.
yours
So,
is easy to find, which is what I love to see. And it's rare. It's rare that folks are doing what they're doing.
and if you open it and look at it, not only does it have all the cannabinoids and it has THC not detected, it also has all the other solvents, the microbial contaminants, the metals, the pesticides. So it's a pretty extensive, which tells you everything you need to know. And I think that's what establishes the quality of it.
When we buy our ingredients, we do look for organic, and we still don't believe them. So we'll get something just like you've got here with the COA. We'll get the independent testing to make sure that what they say we're getting is really what we're getting.
Exactly.
And it's important to be able to produce that COA. At times, when we've been reviewing other products, I've asked for the COA and it can't be produced. That's a company you don't want to do business with.
Exactly. Actually, my manufacturer will not bottle the products till they get the COA back.
That's the right kind of
And
manufacturer.
once they get the COA back and it's all fine, that's when they bottle the products.
We were just dealing with our manufacturer this morning. I tell you, they're a pain in the butt because they're so particular about the details.
Mm-hmm.
Every COA for every ingredient in place. They want the packaging in place. They want everything reviewed before they'll start production. But that's exactly what we want. It's exactly what we're after.
That's what I went through.
Eye for detail.
Even though the product was ready in their lab, they refused to package it, waiting for, and it's a third party lab, so they don't have control over it either.
That's what you want as well. We don't want an in-house lab that can be coached or coerced into giving the wrong answer.
Mm-hmm.
Independent lab testing.
Exactly.
For especially anything that you take internally.
Mm-hmm.
Even if you take that balm and put it on, you haven't put it in your mouth, but it's going in. It's just going to
going in.
get through
It's
the
going
skin
in.
and into the
Yeah.
body. That's why
Exactly.
it's so darn important to have the purity
Mm-hmm.
of that
Mm-hmm.
level.
Mm-hmm.
Really important.
Yeah, I was especially concerned with the metal part because I don't know if you've heard stories of the turmeric contaminated with metal and lead. And this was about the time when I was trying to develop this product. It was important to me to have the turmeric because I know it is effective, but I wanted to make sure that there was no metal. It was tested for metal because I didn't want people to think that somehow this turmeric will also have metal.
It's important to do with every ingredient.
Mm-hmm.
But how do you market?
So right now it's a lot word of mouth. Like I said, I take it for my massage. My massage therapist loves it. She buys it on wholesale from me and resells to her clients. A lot of it's really word of mouth. I've started advertising on Meta. They do as hemp derived product. So, they don't mention CBD because it is hemp derived. But it's not been very successful because I went through the streams of where they're advertising and I see these gummies advertised and it just clogs the stream. So it's very hard to tell what is effective, what is quality product and not. So I know I have a good product. I know it's effective. I've been using it myself, but I need to get differentiated and get it out there so people actually trust it, trust the quality, know it's effective, and try it.
It's a challenge.
It's challenging.
We went down the gummy route. We had a top manufacturer, top labs, absolutely amazing gummies, but we couldn't compete because for us to do it the right way, our bottle of gummies might be $65.
Exactly.
And then you could go to Amazon and see something which is little more than candy being sold for $19.
Exactly.
And consumers could not tell the difference. And that was
Exactly.
such an awful space. Now, the topicals, just like with your topical and your oil, you can differentiate yourself. But with the gummies, boy, it got so crowded and so
Even with the balms, I found that people would say, "Oh, I bought it from CVS for $20, and but it doesn't work for me." And I said, "Just compare it. Just compare it." In fact, I sent it to a friend who was really suffering with arthritic pains, and after a week of using it, she sent me a text. She said, "You are a healer," because she'd been using some CBD balms and she said it doesn't work. But when she used this stuff, she realized it does work.
have to get some of your stuff. I can't use our product for a massage because it doesn't have the proper feel, but it sounds like yours does.
It does. And that's one of the things my massage therapist loves. She says it's got a great slip.
It's got to have that.
It's got a great slip. It's got a, obviously the smell is wonderful and the slip is really good and it's not sticky. So even if you apply it on your hands and all that, it gets absorbed and it's not sticky. A
Okay.
friend of mine, she has arthritis in her hands and she applied it and she said, "Alka, my hands are so loose now. I've not felt that for a long time." And she said, and it's not sticky, she said, "You should sell it to the spas who do mani pedi."
We call ours Inner Warrior. This is for our, what we use for fibromyalgia, for pain, muscle pain, really effective. And it would be a really bad choice for a massage because, among other things, we use hyaluronic acid,
Mm-hmm.
which is great for the joints, great for the skin, but there's no glide.
Right, right. This, yeah,
Yours, like great fit. Mine for massage, a poor choice. It'd be a good follow up to the massage during the massage because you've got to have the right feel, and if you've got the right ingredients and the right feel, that is even better.
yeah, and that is coming straight from my massage therapist
Well, you
because
would too. If you didn't have good glide, oh, you'd feel it.
this is the best that she's used. She actually finds the glide on this better than some of the lotions that she uses.
By the way, the fact that you have fibromyalgia and you can get massage is pretty cool because some folks who are not getting the relief they need, if they have fibromyalgia, they have a hard time getting a massage.
And I don't go to a hotel, for example, to get a massage because I come back with more pain because they don't understand. That's why I go for a medical massage. I think they understand the pains and the body better. I also don't like very deep massage for that reason because that again gives me more pains. So I think medical people, massage therapists who are trained medically understand the pain and they can give you massage accordingly.
How often do you get a massage?
It depends. Once in 2 weeks or once in a week, depends on how I'm feeling. It's a reset for me.
It is a good reset. I go through the same thing, although mine's a little different. I have orthopedic issues, not fibromyalgia. I've had 20 orthopedic surgeries.
Wow.
I know, but I haven't had a surgery, no orthopedic surgery in 10 years. This is the longest I've gone since I was a teenager. But among other things, I use the products and I get body work every couple of weeks, either with a physical therapist or a massage therapist. Moving, which is an essential part of the wellness. Some folks will balk at the cost. In fact, they'll look at your product and say, "Oh, that's expensive." I can tell you, it's a lot cheaper than being sick,
Exactly.
being debilitated. A lot cheaper than missing work or missing out on life.
Exactly. And before I developed this product, I was spending, obviously, this is not covered by insurance, but it was giving me the relief that I was spending that $100 or $120 at that time to get this on a monthly basis because it gave me the relief. It was like, okay, if I can get even a few hours in a day because of this, that's worth it. It's actually it's less than a coffee a day, you know.
Being and your
Yeah,
wellness.
yeah.
Yeah, it's so important. It's a lot better the wellness and health in your hands. before you get that debilitating sickness.
Right. Exactly.
Life is so much fuller. In fact, we developed a tagline. It took me a long time to come up with this. Hurt less, live more. We actually trademarked that. Hurt less, live more.
I like that.
Theme of everything that we do, all of our communicating, because we're trying to help people to hurt less
Mm-hmm.
back into life. They can be more productive at work. They can have a vacation.
Hurt less, live more.
Yep, hurt less, live more.
I like that.
It's a great theme to message around. And it's such an important part of what we do for folks, like with fibromyalgia, which can be debilitating. And then what's pretty sad is when you get the debilitating pain, your world gets smaller. You can't
Your
go out
world
with
gets
friends.
smaller.
You can't go out for recreation.
Exactly. And at the lowest point, like I said, my accomplishment, if I could get up and take a shower, that was my big accomplishment for the day. But the real awakening came was when I was about 40 and I I had so much pain that I couldn't lift a glass of water. And I had to get my kids to lift it for me or get it from the cabinet. And that's when it hit me that I'm 40. I can't live like this. I have my whole life in front of me. And now I feel my heart is fine, all my medical tests are fine. So that's not going to kill me. So I need a life that I can live and feel good about it.
And you said 40?
No, I'm not 40 now. I'm 65. I just had my 65th birthday.
When you had that epiphany, when you when you were in that much pain.
I was at 40 and I said, I have almost a half of my life to live and this can't be my life.
No, that's hard. But so far you're on a good path.
I'm on a good path. And after my cardiologist and all the doctors said, my cardiologist fired me. He said, you don't have to come back. My diabetes doctor fired me. She said, you don't have to come back. You're fine.
When we get old, we're supposed to see those doctors more and more. At least that's what we're.
I know my doctors are firing me because they feel that they can spend time with more needy patients. Yeah. And that's when it hit me that I don't have any of these conditions that will kill me. So I better live a life that I want to live.
Nice. Well, it's good to be on that path. That's not the trajectory of most people our age. And you said you're 65?
I just celebrated my 65th.
Just ahead of me. I just turned 60. And like you, I'm in better shape now than I was a decade ago.
Mm-hmm.
I can do more things. I can do more in the yard. I can go to Disney. In fact, I'll go all day long. The kids sometimes cry uncle because I like to be there when the park opens and when the park closes. And they don't have that kind of stamina. But I do now. I couldn't do that 10 years ago.
Yeah, exactly.
I just couldn't be out that long.
Exactly.
Mow the lawn, I was done for a week. I'd be in too much pain to do any other exercise or work, physical work for the rest.
Yeah. Yeah. And like I said, I couldn't walk a block at the height of my pain. Now I do 20,000 steps, not every day, but when we are traveling. But my body is capable of doing that now.
Okay. Where do you see your company going in the next few years? Plans, any growth ideas or product ideas?
So once this gets on a trajectory, once my marketing and sales get sorted out, I do want to add some more products. One of the reasons I did oil and not gummies is because it starts the absorption in the mouth, and starts becoming effective right away. Because in the stomach, if you take it in a gummy or a pill form, you lose 80% of it. 80% of it just goes through your system without getting absorbed, which is why I did the oil. And I was considering doing gel caps. And then somebody said, you know what, if you do gel caps, it seems more like a medicine. It doesn't seem like a natural thing. So you might want to think about that. But anyway, I want to do it in different forms. Maybe a gummy, I don't know. I don't want to compete with cheap gummies. And maybe strip, a strip that you put on your tongue.
I like that.
So it starts getting.
Somebody, the message, it needs to stay in their mouth for a while, which leads to
Right,
absorption.
right, right.
And the capsule, if you can get a capsule that's maybe double coated so that doesn't all dissolve and open up in the stomach, but that takes some pretty
Yeah,
fancy
yeah. So The double capsules are an alternative which I might consider, because then it goes through your stomach and goes into your intestines, and so it doesn't have to fight with the stomach acids.
Interesting. Well, I'd love to see that if you can make those breakthroughs.
Yeah. Yeah. So I think right now I know my formulation is the one that works. It works for me. It works for anybody else who tries it. So I want to experiment with more forms.
I like it. I think there's a lot of opportunity, especially given the quality of what you're doing.
Right.
The
Right.
biggest challenge is just differentiating what you're doing from those who aren't nearly as careful about the quality.
The other thing that I can do, and I actually have people who use these drops and make a tea out of it, because it's like tulsi ginger tea, and they love that because then they can sip, and actually it gets it the opportunity to be absorbed more. Maybe I'll do a tea.
I like that. Gosh, if you did a tea, you might be able to put that in a tea bag because you could do dry isolates. That'd be interesting. I have not seen that before, I don't think. And you could do that even in a tea bag or even
Hmm.
a little scoopable,
Hmm.
stay blended. Yeah, sign me up for that one too. I would definitely give that a try. It'd be a nice way to get somebody to slowly dose while they're sipping their tea.
Exactly.
Wonderful.
Exactly.
Interesting. All right, I like it.
Good.
It's a lot of opportunity. A lot of
Good.
for somebody doing it the right way, which you obviously are. That's awesome. Well, I'm glad you took time to be on the podcast. This is wonderful information. Folks, if you want to connect, if you want to find our company, look down at the show notes. You'll see everything you need to connect, to find the products, to find the oil and that balm. I'm getting a massage next week. I'm going to order up some of that today. I think that's wonderful.
Great.
Great to have. And we thank you guys for tuning in. This was great. Thank you, Alka.
Thank you. Thank you very much.